Dr. Bart Hodgins. A lot of people have watched the neck video and we're starting to get some questions. So I thought I would take this one here. It's a little bit more of a difficult question, but we're going to dig into it and try to help our friend from India. So I'm going to read the question here. Dear doctor, I have a disc herniation changes at C3, C4, and C5, C6 in my cervical spine MRI. So this patient has an MRI. They've been diagnosed with a disc problem at those levels. I have weakness, numbness, tingling, and severe tinnitus. If you don't know what tinnitus is, it's ringing in the ear, okay? When I adjust my neck, the tinnitus little calms down. So he's saying when he adjusts his own neck, the ringing in his ear slightly reduces, but how do I treat this? Kindly advise. I'm from India. Okay, so let's talk about this on the model first. Okay, so here we are, the cervical spine is here. So on me, this is the cervical spine. And this particular person has an issue in this area right through here. You see these things? These are the discs here. Okay, so they're having issue here, and most likely they're probably trying to do this, and they're getting a little bit of movement. Why they're doing that is because when we have a disc issue, the whole spine right here can become very rigid. So if you're at home and you're not sure what's going on, you should be able to turn your chin fairly freely over to your shoulder here, and same the other way. If you can't do that and it feels real rigid, most likely you're having a hard time individualizing each one of these movements. And that's what I think is going on here. So when you start getting ringing in the ears and you start getting all these different symptoms that come along with that, you're gonna have a lot of muscle tension, a lot of contraction, range of motion, and obviously pain. So what can you do when you're stuck with this kind of thing? You're not exactly sure how to proceed. So it's reasonable to say if the discs come down and get compressed this way and they start squeezing, it would be a really, really good idea to help unload them in an axial way or this way. So if you remember from the video and I was showing you how to roll back and move your neck back like this to try to get some neck pain relief. If you can try to continually have a good posture, and I mean upright like this, and if you can slowly work back, you might even want to take your hands like this and just slightly cradle and lift this way, that should give you more relief. So in this case, I'd like him to put a hot pack on his neck and try to soften the muscles. I'd like him to use the information in the other video to slightly go back, take a look at his workstation and try to maintain good posture at work and to try to get some relief in this area. If he has the option to seek treatment, we would really, again, want to try to do an axial unload this way, okay? So you might try to find a doctor or a clinician practitioner that has some experience with this. They might have like a light cervical traction unit or a decompression table, something like this. From an adjustment standpoint, if you can individualize each one of these here, right? If you start regaining freedom like this, that helps hydrate the disc. I'm gonna grab a different model here. Okay, this is the low back, but it's much bigger than this, so it makes more sense for me to show you. If you look at the complex of the bone, disc, bone, and you imagine this getting squeezed down, and then take a look at this in the neck where it's much smaller to begin with, problems can happen quicker. So if we can reduce pressure over that disc area, opening it up and drawing fluid back in, you're gonna get quite a bit of relief. So if you can get the individual movement back, get some fluid coming back in the disc, this is gonna be a very beneficial way for you to help what you're doing. Also, remember this, be very careful adjusting your own neck. I'm gonna explain really quick why. If you keep cranking on your neck, you have an artery here, and you don't wanna do any damage to that. So be careful, especially if you get so frustrated and you start over twisting your neck. Don't want to be doing that. So I hope that helps. If you have any other questions or something didn't get explained the way you were sure how to interpret it, go ahead, ask another question, and we'll try to answer that for you.